mynews.studio.
A nation made up of hundreds of islands, a global milestone, and not a single baby born with HIV? How did the Maldives manage to achieve this?
Today is November 1st, 2025. The Maldives has just been recognized by WHO as the first country to fully eliminate mother-to-child transmission of HIV, syphilis, and hepatitis B. It's a major public health achievement, but it does raise a question. Why the Maldives, and why at this point in time?
It's a fair question. Just to set the scene, the Maldives is a chain of hundreds of islands, many quite isolated. For years, these three infections, HIV, syphilis, and hepatitis B, posed serious risks to newborns, especially in lower-income regions. In the Southeast Asia region alone, tens of thousands of pregnant women deal with these risks every year.
So what changed there? What did the Maldives do differently to break that cycle?
The turning point came more than 10 years ago. The government started investing over 10% of its GDP into health, which is actually a big deal for any country. That investment led to universal health coverage. Think prenatal care, diagnostic tests, vaccines, all free and within reach, even for people who just moved there.
But in practice, did most women really use those services? Or was there still a gap?
Yes, the numbers are striking. Over 95% of pregnant women got antenatal care. Almost every pregnant woman was screened early for HIV, syphilis, and hepatitis B. And the immunization program was strong. More than 95% of newborns received the hepatitis B birth dose on time and finished the full vaccine schedule.
That's high coverage. But it makes me wonder, with all those islands, how did they keep everything consistent? It sounds like a logistical headache.
The key was integration. The Maldives built a health system that focused on universal and fair access. Testing, treatment, vaccines, they were all free, all included in a national social health insurance plan. Even people on remote islands or migrants were covered.
And on the technical side, how did they actually monitor outcomes and make sure the quality stayed high?
They improved lab networks and introduced digital health information systems. Real-time monitoring was a game-changer. Health workers could track cases, follow up, and there were checks at every level.
It seems like international partnerships must have played a role, too. Did the Maldives work with outside agencies?
Yes, collaboration was central. The Ministry of Health coordinated with WHO, UNICEF, and local health workers. Community involvement mattered as well. There was outreach and follow-up even on the most isolated islands.
Let's talk about results. When did they actually reach zero cases?
By 2022 and 2023, the Maldives had no babies born with HIV or syphilis. A national survey also found zero hepatitis B among young children. That meant they surpassed the elimination targets.
So, who validated this in 2025? What does that mean for other countries? Is the Maldives model something others can use?
Some strategies can be adapted: universal, free antenatal care, integrated services, digital health tracking. The Maldives also required employers to provide health insurance for migrants, which made sure everyone had coverage.
But not every country has the same resources. What obstacles might come up for others trying this?
Funding is a major issue. Not every country can dedicate so much to health. Fragmented health systems can make integration tough, and digital infrastructure isn't always available. Then there are legal and social barriers, especially when reaching marginalized groups.
So, what does it actually take to get past those barriers?
Strong political commitment is essential, along with international cooperation, engaging communities, and a real focus on equity. The basic principles, integrated services, inclusion, and using data for accountability can work in different settings, even if the details have to change.
Looking ahead, is the Maldives doing anything new to make sure they keep these results?
They're expanding digital health platforms, continuing outreach to key groups, and keeping up partnerships with international organizations. The plan is to keep prevention and monitoring at the highest level.
Why does this achievement matter on a global scale?
It shows that a small country, even with limited resources, can lead by example. Millions of infants are still at risk worldwide, but the Maldives demonstrates that universal health coverage and community involvement can end mother-to-child transmission of these diseases.
So, the bigger lesson isn't just about health systems, but about making intentional choices, political, social, and practical. The Maldives has shown what's actually possible.
Yes, thanks for joining us as we explored how one island nation made such a significant mark on global health.
Thanks for listening. This episode was made possible by mynews.studio. You can try it now for free.